or follow-up. And more medical reports remain in the patient's charts at the institutions where they were seen, because there is no family physicians to forward them the report to. I want to share with you, Mr. Speaker, a story that I can recall. I recall getting a call from an elderly man from Clare who went to the QE2 for an operation, but before he was discharged, he was asked by the surgeon to whom the report should be forwarded to. So again, this elderly man indicated to his doctor that he didn't have a family doctor at home. Of course, the surgeon, not knowing the situation at home, wanted to know why this man did not have a family doctor. Mr. Speaker, this elderly gentleman broke down at this point and started crying. And when he called me upon his arrival from the QE2, he broke down again while he was telling me his ordeal. Mr. Speaker, I tried to comfort him and reassured him by making him aware that he was not the only one in the same predicament, and that I would do my best to address his concerns. Mr. Speaker, who does the yearly physicals for men and ladies that don't have a family doctor? Or yet, Mr. Speaker, who refills the many prescriptions needed for our seniors? Seniors are unable to grasp the concept of seeing a different doctor when in need. The continuity of care is so important to them, Mr. Speaker. Again, who removes the casts, the sutures that were put in at the ER department? Again, who removes the sutures that needs to be removed post-operatively? Who visits the elderly and the sick that are bedridden in their own homes? Who renders to the needs of the home support workers, the RNs, when new orders are needed for treatment or medications? Who renders, Mr. Speaker, to the need of the caregivers in the senior nursing homes when orders are needed for the care of these individuals? I know, Mr. Speaker, at our nursing home at La Villa Acadien in Meteghan, every day some of our residents need to see a doctor, need a prescription, need some doctors' support. Mr. Speaker, this government has talked, has announced, has pledged, has promised a renewed effort to recruit doctors, particularly for rural Nova Scotia. But I'm afraid, Mr. Speaker, if this Tory government does not hurry up with recruiting, we are going to lose some of our own doctors because of the heavy workloads and their responsibilities. Our doctors have long hours, and yes, you have to consider the possibility of burnt out. I do not know, I can't even start imagining to know how our local doctors right now are able to do their job. The number of patients per practice is certainly beyond acceptable numbers. I recall asking my own family doctor how many patients he had, and I remember he told me too many. And then he went on, he's got over 4,000 patients that he's trying to look after. Mr. Speaker, as I understand, according to the Canadian Medical Association, the acceptable numbers of patients for a rural family physician is between 1,600 and 2,000 patients. And I know all doctors at home, all 4 doctors that I've talked about earlier, they have well over 1,600 patients within their practice. Mr. Speaker, I've heard many residents express their concerns for the well-being of our physicians. Some of them are afraid that they will lose their own family doctors because of their heavy workloads and their schedules. Mr. Speaker, these dedicated professionals, men and women doctors, deserve better working standards, reasonable working standards, and furthermore, Mr. Speaker, our 4 present doctors in the Clare-Weymouth area, they work together to provide an on-call service to the people. It's a daily 24-hour rotation, which is provided 365 days of the year for urgent medical needs. Yes, that includes weekends and holidays, Mr. Speaker. This on-call service, Mr. Speaker, gives reassurance and comfort to our residents. This provides a service for the individuals who do not have a family doctor. But again, this service was made available for urgent medical needs. Luckily, the individuals that do not have their own family doctors are able to access these services for removal of sutures, prescription refills, sore throat, earaches as well. Again, this does not provide the services for the medical yearly checkups. The residents of the area are very appreciative of this on-call system because they are well aware of the waiting game, at the local ER departments, at the Digby General Hospital and at the Yarmouth Regional Hospital. Mr. Speaker, I'm told the waiting time at the ER in Yarmouth right now can be at least 6 hours, anywhere between 6 and 10 hours. So again, Mr. Speaker, these dedicated doctors go beyond their call of duty. Covering for a weekend certainly makes a long, enduring 12-day stretch. After you've put in 5 days or 5 days a weekend, and then you start again for your next 5 days.
Order,
I know
please. The honourable member's time has expired. Thank you, and the motion is carried. Thank you.
Recognize the Honourable Government House Leader.
Mr. Chairman, would you please call the estimates of the Minister of Health?
I'd like to call the estimates for the Minister of Health.
What's that? Deputy Minister of Health.
Oh, all right.
Recognize the Honourable Member for Halifax Clayton Park.
Yes.
Maybe we'll wait just a minute until the Minister's assistants are here. We might actually have another speaker. Okay. I don't know.
The Honourable Member for Halifax Clayton Park, you can start now.
Oh, we're ready to begin. I think the Minister will know. Yes. Thank you very much. Yes, he's given me permission to begin. I appreciate the opportunity just to ask a couple of questions today. My colleagues have allowed me to jump into the queue and ask some of these questions. The main area that I wanted to explore today was the self-managed care, the program both that's been proposed by the government this year and maybe the shortcomings of the current situation. I'd like to really explore whether the proposed program is going to answer very many of the problems that we've experienced over the last year. And the Minister is, I think, quite well aware of a constituency issue in the Clayton Park riding. And I know there are more than one person, really, who in my riding who would be needing this service. But the issue came to my attention and came to a head in the Clayton Park area because of a gentleman who is a constituent of mine who is unusual in the circumstance that he actually works and has a job, although he is confined to a wheelchair and is requiring home care every day in order to maintain that work schedule. And what came about after something like 20 years of receiving home care, this past fall, he had a falling out of some sort with the VON, and the VON refused to continue to provide service. And what came to my attention as a result of that was that even the Minister of Health of Nova Scotia was unable to reinstate service or provide an alternative service to the VON that is our, as I understand, our contracted service provider. And I thought it was really a terrible omission on the part of the government that we don't have any backup in place or any other facility to meet that need when and if this one single provider can't make it for some reason, for whatever reason, that there's a falling out or a dispute or something that becomes a terrible obstacle in the delivery of the service. So the question I would like to pose to the minister is whether or not we've now gone beyond that and there are alternatives to my constituent and to any others who find themselves at that impasse. If I could.
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman. And the honourable member would appreciate, Mr. Chairman, that I'm not in a position to discuss individual cases on the floor of the House. Having said that, I do want to, if for a few moments, if I might, address some of the challenges that exist with respect to the provision of home care and the fact that there is a provider of home care services. And one of the responsibilities we have, in addition to doing our very best to make sure that the services that clients require are in fact delivered, we also have a responsibility to ensure that those who are providing the service are in fact secure in their feelings about what it is that they're doing. And that sometimes becomes a very real challenge. Unfortunately, we are dealing with situations where personalities don't always harmonize in a manner that we would like, and that does create some difficulties. And now, without delving into details of a particular situation, I want also to suggest that the self-directed home care program, which we are providing for in this budget, would provide an option that may be considered in circumstances as described by the honourable member. And the honourable member does point to the challenge that exists when there is an impasse. Sometimes the impasse is one where those receiving the service need to recognize that and accept the rights of those who are providing the service. At other times, the impasse may be of a nature that is that, as the honourable member suggested, there is no apparent resolution, and in those circumstances, it becomes a bit difficult to provide the solution that is required. And I do know that every effort is made when those situations arise to try and create an environment where the service can be provided both to the satisfactory benefit of the client and to the satisfaction of the caregivers with respect to their own situation in terms of providing that care. But the self-directed program does provide us with an alternative to consider in circumstances such as this. Whether it is going to be the cure in those circumstances, I can't make that determination. I think healthcare professionals would have to make that determination.
The honourable member for Halifax Clayton Park.
Thank you very much. I would like to pursue this a little more, and I'm glad the minister's made the mention that we can't talk about specific cases. The case I have in my mind, I think, is illustrative of other cases that are across the province, and that became clear when we had a discussion about home care at one of the legislative committees a few months ago. It was clear that every MLA that sat in the committee had at least one or two that they could think of right off that fit this scenario. I guess, again, there's two things I'd like to ask specifically. One is that during discussions around the provision of home care, I was told specifically that home care is not an insurable service. And that was said in a way that I thought was kind of ambiguous. I'm not sure what was meant by a Department of Health employee saying that home care, it sounded to me like we're saying home care is not a right. A person isn't entitled to home care. And I, really was quite shocked if that is the interpretation of it, because if a person does not get the home care they require, they will be hospitalized or they will be institutionalized, and that is a cost to the government when that occurs. So I just wondered why, or if you could explain further what a person, an employee would mean when they say home care is not an insurable service. And if you could explain, it's, as I say, it sounds somewhat like a threat, that it's something you're getting maybe because you're lucky to get it, and if you cause any trouble, you won't get it. It's not an insurable service. Perhaps you could just tell me if that is true or what it means. Thank you very much.
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman, and thank the honourable member for the question. The facts with respect to home care are that it is not a service that is covered under the provisions of the Canada Health Act. So it is not something that MSI pays for, but it is something that is funded by the Department of Health, and we provided approximately $100 million toward home care last year. So there shouldn't be any intimation of threat with respect to a statement of a fact like this. It simply refers to the fact that it is a service that is not covered under the provisions of the Canada Health Act.
Thank you. The honourable member for Halifax Clayton Park.
Thank you. I would like to explore that just a little further. Although it's not covered under MSI, does the government of Nova Scotia feel that that is I guess, a right of Nova Scotians who are disabled and need home care? Can we regard it as a right for them to have that service and remain active in the community?
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman. The government's view of home care is the issue as to whether it's a right or not a right is not how we view it at all. Our view of home care is that the more services that we can provide in homes, the better job we're going to do of ensuring that people do not need acute care services in our hospitals. And the more money and more resources that we can commit to home care, obviously it is a much more efficient option with respect to expenditures of dollars than allowing individuals to deteriorate to the point where they require acute care. So our view of home care is that it is a service that should be enhanced. We're not without our challenges in terms of being able to provide that service in the manner in which we want to provide it, but we're certainly committed to providing it, expanding it, and currently the continuing care department of the Department of Health are involved in a province-wide consultation, and a very important part of that mandate is to look at ways that we can expand home care services and provide alternate levels of care to acute care, so that we are keeping people in their homes for a longer period of time and out of institutions, whether the institution be acute care facilities or whether they be long-term care facilities or residential care facilities. If they're in the home, that is obviously a much better option, both from the perspective of the commitment of resources, but more importantly, from the perspective of the individuals who are able to receive care in their home and remain in their home environment for as long as possible.
Thank you, Minister. The Honourable Member for Halifax-Clayton Park.
Thank you. I wasn't aware that you're doing the province-wide consultation. I hope that that you're touching many of the stakeholders, including those that receive service. I will look into that afterwards. But what I'm wondering is whether the Department of Health does any surveys at all about the customer satisfaction of those people that are receiving home care. Independently, not having the VON themselves do it, but do you do any yourselves to see if those customers, those clients, the patients that require home care are in fact satisfied, comfortable, trusting of the care they receive? And too often I think there's a feeling that because we've put all our eggs in one basket and we depend only on the VON to provide this service, that the recipients of the service are frightened to speak out, and they're frightened to make their feelings known if they feel it's inadequate in any way, because they will become known as a difficult person or a difficult client to satisfy, and ultimately you could lose your home care if you're too difficult. So people, I think, are that there's a sense of unease about expressing their views. So I'd like to know if you have any statistical surveys, any customer satisfaction surveys that were done.
Thank you. The Honourable Minister.
Thank you very much, Mr. Chairman. And the Honourable Member raises a question which is very appropriate, and that is related to our capacity to be able to measure how well we do in the provision of the services that we provide, and being able to get the level of feedback that will help us improve the level of service that is being provided. We do not have the statistical information the Honourable Member references. And that is not to say that we wouldn't want to have that, and we are working at improving our capacity to gather that sort of information, and we view it as being an integral part of what we need to do relative to the provision of home care, so that we can do a much better job of, first of all, satisfying ourselves that we are doing for our clients what we should be doing, but secondly, to ensure that the contractual arrangements that we have with the providers of care are living up to the standards that we want to see provided. And it is only when we are able to clearly articulate those objectives and find a method of measuring ourselves to those objectives that we will be in a position to effectively deal with those who contract to provide services on our behalf. So the member is correct in identifying a challenge that we have. It is a challenge that we are working on, and one that we're committed to meeting.
Thank you, Minister. The Honourable Member for Halifax-Clayton Park.
Yes, thank you. I have just a couple more questions still centered around this, if we could. Again, we've made what I understand is a contractual obligation or arrangement with the VON to provide our province-wide home care services. There may be a few pockets around the province where another agency or group is doing it, but I think they're fairly isolated. What I would like to know is why we haven't opened this up to other care providers, so that, again, it would give the department and the minister himself more flexibility when real complaints emerge and again, an impasse is reached, and it may very well be personality conflicts. But one can only imagine the frustration of people who are disabled having to deal every day with their infirmities, their inability to do things when they're mentally fit and able, and yet they can't do a lot of things physically. It's natural that there would be some frustration and perhaps sometimes some anger. And I think that even then the home care workers, I'm sure, receive training, and if they don't, they certainly should be receiving training in dealing with difficult people, just as you would in a hospital where people are sick and perhaps not their personalities are, strained. But what I'd like to know is why we haven't opened up to other care providers, why we haven't got any other contracts. And in fact, I think it's worth noting, I don't believe there is a signed contract with the VON. I think it's an arrangement or an understanding. But we had asked earlier in the year if you actually have a contract with the VON, and you might want to answer that question as at the same time. But it seems that we feel we are obliged to work with only one care provider, and I'd like to suggest that we open that up and that more companies be given the opportunity so that, again, there's flexibility built into the system. So if the Minister could reply to that, please.
Thank you, Member. Minister of Health.
Thank you very much, Mr. Chairman. The contract that does exist is indeed an old contract, and it is dated, quite dated. Before we're in a position to be able to renew a contract, we need to clearly articulate the deliverables that we want to see contained within such an arrangement or such a contract. And that is the focus of our efforts at the present time. We very much want to reach the stage where it will be possible for us to, because we're clear about our deliverables and what it is that we want to achieve, to bring forward a request for proposals relative to the provision of these services. But we still have a little more work to do in terms of articulating the deliverables relative to this service. And when we have done that, as I indicated, our objective would be to put ourselves in the position where we could call for proposals if we wished, or at least sign contracts that allow us to be assured that we are meeting those deliverables. So the honourable member does, as a result of her experience, point to an area where there is room for considerable improvement. But I want to be fair to the individuals who are providing the service to our clients. The number of cases that I wind up, or my office winds up having to deal with relative to these circumstances are not great in number. There are a few where it is necessary to try and arrange some resolution. And in those circumstances, we work very hard at trying to do that. But by and large, when you consider the fact that the expenditures are in the vicinity of $100 million to the provision of this service, the number of complaints that we get are relatively few. But as long as there is a single complaint, then there is room for us to be able to continuously improve. And as I indicated earlier, we can do more work, and we're doing more work with respect to articulating deliverables and then finding a vehicle or contract method of providing those deliverables. I would like to point out to the honourable member that in last year's budget, there was an amount of money allotted to help with the management of what's the phrase I'm looking for? Yeah, of challenging behaviors, and assisting personnel who are providing the care to be able to cope with those circumstances. And very often, if a person is properly trained, then they themselves can develop the capacity to be able to overcome the challenging behavior incidents and bring about a resolution of them without having to go to a third party. But that requires training, and we've begun the process, and I understand that money is in the base and it's ongoing, so that we can expect to see a level of improvement in that regard, simply because our providers will be better equipped to be able to respond to these circumstances.
Thank you, Minister. And the honourable member's time has expired. I have to say that there was a bit of confusion as to how much time was allotted. Should have been allotted to you, and we made a decision based on the best information we had possible, and we have to move on from there. It was beyond our control. I'll recognize the honourable member for Halifax Needham.
Thank you very much, Mr. Chair. Minister, The Daily News today is reporting that the Federal Minister of Health has written a number of provinces, including the province of Nova Scotia, regarding concerns about private for-profit healthcare delivery in the area of diagnostic testing. I'm wondering if you would inform members of this House what specifically the Federal Minister of Health has said his concerns are, and how you intend to deal with these concerns.
Thank you, the Honourable Minister of Health.
Thank you very much, Mr. Chairman. I thank the honourable member for the question. Indeed, the federal minister did write to me, and I can tell the honourable member that between getting from my constituency office to Halifax today, I was rather rushed in terms of what I was able to be brought up to date on. But I did read what could be considered the operative paragraph of the minister's letter. I've yet to have an opportunity to go through it all. I'm told that he is, in a general way, wants to become familiar with the issues as they exist within the various jurisdictions across the country. And the operative paragraph that I read was one where he requested that his deputy minister meet with the deputy minister of this province to explore this and other issues related to the provision of service. And I can assure the honourable member that my response to the federal minister will be of a positive nature, that we have, in fact, through the deputy's office, been meeting with officials of Health Canada on a regular basis. They're very much aware of the circumstance in this province. We've been as forthcoming as we possibly can be with them, and if it's the federal minister's belief that a meeting of the deputies to explore this particular situation, then we'd be quite happy to provide that opportunity. I will also point out that it is the subject of discussion among the deputy ministers of health right across the country. We're very much prepared to have that discussion, and we're looking forward to being able to develop a common approach with respect to dealing with this. I believe that our common approach might be somewhat challenged as a result of some diverging views that exist relative to the provision of services like this across the country. Certainly the view of the government of Nova Scotia compared to the view of what I see coming from a province like Alberta is quite different. And so whether a common approach can be possible or not remains to be seen, but certainly we are in no way reticent about sitting down with the Federal Department of Health. And as a matter of fact, I extended an invitation to the federal minister to come to Nova Scotia to see what we are doing with respect to the whole issue of wait times. And I'm hoping that he'll have the time to be able to respond to that invitation in the near future, but this week might determine whether that time would be available.
Thank you, Minister. The Honourable Member for Halifax-Needham.
Thank you very much. And I want to thank the Minister. Minister, I'd like to know how many people inside your department are responsible to monitor the private delivery of health services in Nova Scotia, and particularly with respect to the private MRI. What has been happening? The private MRI has been now in existence in this province for, several years now, and I would think that there would be ample opportunity to really explore what impact that private facility has had on the public facility with respect to any any queue jumping that may have occurred, any leaching of health human resource personnel from the public system into the private system, et cetera. So I would be most interested in knowing how many people in your department are responsible for following this, and to what extent have they been able to monitor and to get a pretty good handle on what the implications have been. I would assume that if the federal minister is interested in knowing what the situation is here in Nova Scotia, this would be information that he will be looking for as well.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. The first question of the honourable member was how many people are involved in it. It's difficult for me to provide a precise number. Perhaps I can describe how it is monitored, and it would assist the honourable member in understanding what goes on. We have, of course, acute care division of the department, and we have a division for medical services within the department. We work very closely with the District Health Authority and with Doctors Nova Scotia and the College of Physicians and Surgeons, who have their own regulatory role to play. Now, the services that are provided by the clinic mentioned by the honourable member do require the services of individuals who provide service on behalf of Capital Health. We're, to the best of our knowledge, we're not involved in a situation where resources are being taken away from the Capital Health in order to provide services in that facility. When it comes to the issue of queue jumping, one of the things that we need to do, and the department has been working on this, is to develop a legislative capacity to be able to effectively monitor and regulate and control circumstances such as a clinic like this one or others that may exist now or may exist in the future. I have the department's target with respect to that legislation was to have it ready to bring forward in the spring of '06. I have requested that they try to revise their objective to the fall of '05 with respect to that legislation. I'm not committing to that date because I don't want to put us in a circumstance where we are not doing the level of consultation once we provide a document or a set of guidelines, that we're not hastening the consultation process in such a way that it is compromised. So my target is the fall. I may miss that target because the interest and the reaction to the consultation and our capacity to consult may require us to go a bit longer than that, but certainly we would be looking at the spring of '06 at the latest with respect to bringing that legislation forward, and I would very much like to be able to bring it forward in the fall of '05. What I might wind up doing, of course, is in the fall of '05 is tabling something that we could get reaction to across the province and then proceed further in the spring of '06. But that remains to be seen. I can assure the honourable member and other members of the House that from a legislative perspective, it is a priority of the department and something that we need to resolve in a manner that gives us the capacity we need to deal with these situations.
Thank you, Minister. The Honourable Member for Halifax Needham.
Well, thank you. It's unfortunate that it takes such a long time, I think, sometimes for government to respond to concerns that the public and and members of the opposition express, when the private MRI clinic opened, we were very concerned here in this caucus about the implication. And I think probably I should have, rather than ask you how many people in the department are tasked with the job of monitoring and analyzing the impact, I should have asked maybe, has anyone in the department been tasked with the responsibility for monitoring or analyzing? And I think the answer to that is that that isn't the case. There is nobody who has been tasked with the responsibility. And I think that's, I think that is unfortunate, because now we have a lot of confusion around this additional facility that's about to open. And I want to ask you some questions with respect to that facility as well. I think we all are aware that the public system has been used not only for the provision of public insured health services, but also there have been some private uninsured services provided from time to time in our public facilities. And I don't know if the minister had an opportunity to hear a 3 or a 4-part series that was carried on CBC's The Current sometime this winter, but they did a series on the use of operating rooms across the country by physicians, surgeons, often for non-insured procedures, primarily in the cosmetic surgery field, plastic surgery field, and that certainly in some provinces, some of the surgeons in certain facilities were raising their objection to the fact that public operating rooms were being used for private provision of healthcare uninsured services, and that the amount of money that was being charged for the use of the operating room in the private facility was quite minimal. I think I heard $150 an hour in terms of British Columbia, where I think some of the concerns that drove this program initiated. Now, when I listened to the program, I was interested to learn that places like the Dartmouth General Hospital, for example, I believe was cited as a place where there was some provision of private healthcare uninsured cosmetic surgery, and no doubt this may be true as well at the Queen Elizabeth. And often the argument was being put forward, or the explanation was being put forward, that the surgeries that were being conducted on sociable times, like maybe 2 and 3 o'clock in the morning or on a weekend when the operating rooms were not scheduled for the public provision of healthcare services. So I think that there is confusion in the minds of the public about what this new standalone cosmetic surgery clinic means in terms of our public system. And so I'm wondering if the minister has been briefed further from on Friday, when I wasn't here for the questioning from my colleague in the Liberal Party, but I understand was somewhat unaware of this new facility opening in Dartmouth. I'm wondering if you've been briefed now on the cosmetic surgery clinic, and if you could provide us with a better explanation for the impetus of the establishment of that clinic vis-a-vis the use of the public system, where I understand many of the surgeons previously had access, and probably some limited access, for uninsured services.
Thank you, member, the Honourable Minister of Health.
Thank you, Mr. Chairman, and I want to thank the honourable member for her question. The facility to which the honourable member refers is intended to provide mostly oral surgery, dental surgery, which is privately operated and privately delivered in this province. I understand that the proponents of the clinic intend to provide opportunities for others to use the facility to provide uninsured elective surgeries in this particular facility, and that for as much as we know about their intent, and the intent is, as I described it, we do not have a concern that it will wind up providing insured services, or that people will be charged for insured services while at that clinic. The intent of the proponents is for the service that's provided to be uninsured elective surgeries beyond the oral dental services that are intended to be provided. So, as I indicated on Friday during a scrum, it may well be that there could be some positive outcomes to this particular facility, in as much as it might move resources away from the publicly funded system to this system for non-insured elective procedures. However, it does raise the issue, and the honourable member referenced it early, of the need for vigilance with respect to how resources are deployed, and to ensure that the resources are not a drain on the resources provided through the public service, publicly funded system. So we're very much aware of that. I do want to correct an impression created by the honourable member that no one is responsible. There is a chain of responsibility within the Department of Health, and that does create, the responsible channels with respect to how matters of this nature are dealt with and are answered within the department. So everyone knows what their responsibilities are.
Thank you, Minister. The Honourable Member for Halifax Needham.
Thank you very much. I want to ask the Minister about the work on wait times. Wait times are something that are of, I think, primary concern to Nova Scotians. It's the #1 health issue, and that I often hear about: wait times for diagnostics and wait times for treatment. And it seems to me that we've been waiting a long time for the implementation of the Wait Time Monitoring Project Steering Committee. The Wait Time Monitoring Project Steering Committee, as the Minister would know, issued a report back in January 2004. And one of the recommendations of that report was to set up a wait time monitoring advisory group, and I believe that has only happened recently in March. I've looked on the government website, and I did notice that this has occurred, or maybe I noticed it has occurred because I read the Department of Health's business plan, but I don't remember any public announcement that this committee had been put in place. And so I have a number of questions with respect to this. I mean, it's taken more than a year to put in place an advisory committee, coming out of the Wait Time Monitoring Project Steering Committee report, which seems to me to be an extremely long period of time. I understand that this committee now is being chaired by Mr. George Cooper, a former member of Parliament and a practicing lawyer here in Nova Scotia. I'm wondering who else is on that committee and how soon we will see the plans to actually implement many of the recommendations in a report that's now more than a year old.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. The honourable member indeed is correct that the committee is operating under the chair of Mr. George Cooper, and it includes physicians and administrators from the district health authorities, from the Department of Health, and members from the public, the general public. And they did get underway in March. Now, I can say that a great deal of work was done leading up to the formation of the committee itself, and they are, so to speak, almost hitting the ground with wheels turning full tilt in terms of the amount of information that they require to be able to begin their work, so that they will be able to take a great deal of this material and start doing some work right away. We have employed a webmaster to develop the website for us so that this can be up and running and make information available to Nova Scotians. And the report identified the process for standardizing collections of data, and much has been accomplished. So, as I indicated, they'll be able to work. And what's important is that the data be data that's clearly understood by all who are involved in the issue of wait times, from the patient to the family physician to the specialist to the district health authorities and the Department of Health, that when we view a number related to a wait time, that we all have the same understanding of what that number means. And given our commitment under the terms of the First Ministers' Conference or agreement in September of '04, we would also want to ensure that the federal government would have a clear understanding of what is meant by all of this. So the data is available in a number of surgical and diagnostic procedures, as well as the time for referral from GPs to the number of specialists, and those are all areas that are priorities with respect to the committee. And I believe that while the honourable member does point to the fact that perhaps a longer period of time than she thought has elapsed with respect to the launch of the committee, that the launch of the committee will coincide with a group or a collection of data that will allow the committee to really go full speed ahead in terms of its responsibilities. And I look forward to the development of the website and beginning the process of sharing all of this information with Nova Scotians.
Thank you, Minister. The Honourable Member for Halifax-Needham.
Well, perhaps we can take this opportunity for the minister to expand a little more about what precisely will be on the website. You know, I find that the report, the January 2004 report, is really quite, it's really quite good for a layperson like myself to read, to try to understand what the complexity is and how to get a handle on really addressing wait times. And I know we've talked here before about how do you define a period of wait? Is it from the time that you get sick and you first feel sick and then you get to see your GP or get the referral to the CAT scan or the MRI, or you get to see the specialist, or when do you start the clock ticking for what the wait time is? And one of the, I think, really excellent things about this report is it looks at, the various areas, not all of the areas that people are in our healthcare system for, but it certainly looks at some of the priority areas where waits have been a concern, and it recommends what the wait time should actually be. If it's the time from which you're referred, for example, for diagnostic testing, from the time that the referral is made till you actually have the test, which seems like quite a sensible measurement for a wait time, and that isn't going to be the same measurement for actually having surgery. There'll be another kind of definition that will define what an appropriate wait time is. But I know that all of the information that I read, and I'm told by people who work in the system and pay a lot of attention to this, is that we have to manage our wait lists better. Not just do we have to have a common definition, but we also have to have a system in place that will allow us to manage those wait lists better. And over again, various bodies like CHI and other groups recommend that we have centralized waiting lists. And so I'm wondering what the relationship is between setting up a website that people will have access to. The average Nova Scotian can go online and look and see what the wait is for, whatever. What the relationship is between that website and actually getting on with organizing a centralized wait list that will actually contribute to a much more efficient access to people getting care. It's one thing to have information about how long waits are. I'm not sure that is enough for people who are waiting. What they really need is they need the service, and they need it in a timely fashion. So what we really need is to get on with doing what all of the evidence and the information tells us needs to be done, which is centralized wait lists.
Thank you, Member. The Honourable Minister of Health.
Thank you very much, Mr. Chairman, and I thank the honourable member for raising the question. Indeed, she makes some very good, raises some very good questions that need to be addressed, and we are addressing them. And the fact that she points out the need for there to be a standard that's clearly understood by all, that is our objective, so that when we speak of wait time, we know the beginning point and the end point, and that is something that all agree to and all understand. We are in the process of gathering that information, and the information that we would provide on the website would be information that would be based on the province-wide statistical availability, or availability of statistics on a province-wide basis, so that I believe what the honourable member is referencing, that it be centralized. The information will be information that will be available to all, and it will be gathered from various sources. If, for instance, if we were to consider the provision of orthopedic services in the province, and we were to provide information there, then there are 4 sites where orthopedic surgeries are provided in Nova Scotia, so that the website would be able to tell physicians and patients what the wait times are in each of those locations. So the general practitioners, in consultation with their patients, would be able to make suggestions to them as to what their alternatives are relative to wait time. If some people may still want to decide to wait a longer period of time to go to the doctor they want to go to. Well, that may well happen, but others may decide, oh, if I can go to this location and have it done quicker, then that's where I would like to go. So there is power in the information, and the power will rest with the patients ultimately, in the sense that they should know and should be able to request their preferences based on the information that is available to them. I don't know if that answers the member's question or not, but that's certainly our intent.
Thank you, Minister. The Honourable Member for Halifax Needham.
Thank you. How many people in the department have been tasked with the responsibility for developing and implementing the waitlist strategy?
Thank you. The Honourable Minister of Health.
It's mainly information management.
Yeah. Thank you very much, Mr. Chairman. To get into numbers is a very difficult thing, because there are a large number of people within various parts of the department and within district health authorities who would be spending some of their time on the wait time project and addressing that. So to come up with a number that says, there are 32 and a half people that are committed to this is difficult to provide a precise number, but I can tell you that officials from the district health authorities are involved. Officials from the Department of Health are involved. We have physicians involved in the process. We have other healthcare professionals who are involved in this process and have worked very closely with us throughout the period of time that it's been under consideration. And the individual within the department who is working on it on a day-to-day basis is Brenda Ryan, and she has done an extremely good job of this entire project. She's extremely enthused about it. She's got the details of the program and is moving it forward very effectively. But she also works very closely with Mary McKean, who is in our information technology branch of the department, because they obviously will form an integral part of this service when it is up and running. It is really about getting as much information as we can and ensuring that the information is standardized so that it is understood by all, and making that as available as we can to all who are concerned throughout the province. So I can tell the honourable member I don't know the exact number, but there are quite a few people involved in the delivery of healthcare in this province that have been involved in the wait time project.
Honourable Member from Halifax Needham.
Well, I'm sure many people are involved, but it's always good to know that there are a few people in the Minister's department who are dedicated to overseeing this project, which is, I think, of paramount concern to the people of Nova Scotia and can't be sort of allowed to sort of happen through disorganized goodwill or something like that, although I'm sure there's a lot of goodwill out there to try to deal with this. You really need to have somebody who has the ultimate responsibility to make it happen and to see to it. So I did hear the name of one person in the Minister's department who is dedicated to working on this, I believe, and hopefully there would be more people than that. Great. Now, one of the things that the Minister has just said, Madam Chair, is that these various work groups are tasked with getting as much information as they can. And that opens up, I think, the question of how are you going about getting the information? One of the things that I read when I read about dealing with wait times is, in fact, getting the various healthcare providers, particularly physicians and surgeons, to buy in and agree to providing information about their patient loads and their wait times. Family doctors and surgeons are very busy people. They have a tremendous amount of paperwork as it stands, and they also, in many cases, are lacking in office technology and computerized systems. And they also, in many respects, view their work and the domain in which they work as in an entrepreneurial way, as if this is their clientele, their information, and what have you. I know that just recently we had a little publication we get as MLAs on a regular basis that comes to us from the Canadian Health Services Research Foundation. And the last one that came out, their last series, was what they call their evidence boost, managing waiting lists centrally for better efficiency. And in it, one of the things they indicate is that moving to a centralized wait list, which they promote, they say it will not be easy. To bring about lasting change, doctors might have to agree to take patients from a central referral service, which would be a huge cultural change as well as a big administrative task. And no matter how well managed lists are or how carefully assessed patients are, in a system where resources are finite, everyone waits for care. So I'm wondering how the department is dealing with the issue that is raised here by the Canadian Health Services Research Foundation based on their work here and across the country, looking at various attempts to better manage wait lists.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. Madam Chair, I'm sorry. I just wanted to take the time to ensure that what I was going to say to the honourable member was that my deputy had the same understanding that I had with respect to what we're saying on the matter. I think it's important that I provide the information only once and that it be as accurate as possible. So I thank the honourable member for her patience in that regard. The honourable member, in quoting from the document, does indeed put her finger on a very real challenge with respect to handling the issue of wait times. We have been, to date, very fortunate in this province in the level of cooperation that we have received from our healthcare professionals, in particular the GPs and the specialists relative to this entire matter. And we recognize that there are some challenges to overcome relative to the provision of this information. And the approach that we will be taking to it is that the information that will be provided publicly to everybody in the province will deal with global statistics, so to speak, so that you will be able to look at the facility in the Valley, if we're dealing with orthopedics, and you'll be able to see that what the number is there relative to the wait time. Or you can look in Cape Breton, or you can look in Glasgow, or you can look in the capital district. The general practitioner, on the other hand, through the Doctors Nova Scotia website, will be able to look at a list that will tell the general practitioner the numbers for each specialist that's providing the service. And so while the patient will be able to look at the numbers globally and be able to approach their general practitioner from that perspective, the GP, on the other hand, will have the specific knowledge. And that is an approach that is receiving the level of cooperation that we feel that's necessary to allow us to move forward. And it avoids some of the challenges that are being experienced in other jurisdictions. Now, I would not want to suggest that we are not without some challenges, but the level of cooperation that we feel we're receiving in terms, compared to some other circumstances throughout the country, has been considerable. And we believe that through this approach, the appropriate information can be provided, and that's where we want to begin in terms of our approach to the issue raised by the honourable member.
The honourable member from Halifax Needham.
Thank you. I'm wondering if the minister would elaborate on what some of the other challenges are that he's dealing with, that he's referred to generally.
The Honourable Minister of Health.
Thank you, and I thank the honourable mayor. I raised the doubt that it's appropriate that she should ask the question. But the other challenges that I'm referring to are, the biggest one always is getting people to find the time to be able to commit to the process, especially those who are outside the Department of Health, even those in the district health authorities. Perhaps, it's a little bit easier for them to find the time, but when you get into the providers of healthcare, it's a challenge to. It's not that they're unwilling, but they're very busy people, and to get them to provide the time is a significant challenge. And communication generally is very important. You do not want to move forward unless you're as clear as you can possibly be that everyone understands the issues that you're moving forward with. Because if you have to stop and start, clearing up misunderstandings, then you can find yourself really delayed by quite some period of time. So we're choosing to invest the time up front to make sure that we get the communications right in the first instance, rather than having to go back and re-communicate and get people off a misunderstanding and get them convinced that their misunderstanding is in fact a misunderstanding, and that the facts of the situation are as we would like to have had them communicated in the first place. So those are the sorts of challenges that we're talking about. And as long as we're able to meet those, especially the issue of communications, we feel we can continue to get the level of cooperation that is essential for this to be successful.
The honourable member from Halifax Needham.
Thank you. When will we actually when will the website be up, and when will GPs, for example, have access to the information you've referred to? And I think more importantly, how long do you anticipate it will be until we start seeing some concrete results in terms of a reduction of wait times and more efficiency in the system after this occurs? What are you anticipating?
The Honourable Minister of Health.
Thank you very much, Madam Chair. I can tell the honourable member that the webmaster has recently been hired, and I'm quite certain I'm accurate when I say recently been hired, as opposed to is going to be hired in the very near future. I think there's something about the beginning of the month as being an important part of that. I will confirm. If it is otherwise, I will convey that to the honourable member. But it is, if the webmaster is not at the desk today, then it's going to be in the very, very near future that that desk will be occupied. And once the webmaster is there, we feel that we have garnered sufficient information that we can start posting that information. I'm not, I don't know enough about creating websites to know just how long the person is going to need, but what I would like to do in the interest of accuracy is to perhaps take it upon myself to provide the honourable member with a more detailed answer to those questions in the near future.
The Honourable Member from Halifax Needham.
Thank you very much. I'd like to move off the topic of wait times for a bit and ask about a few of the items in the budget that I expect people will want to know a bit more about. One of the things that I've noticed in the Department of Health budget is that the cochlear implant line item of $500,000, $500,000 has disappeared. So I'm wondering if the minister could tell us where it went, because I can't seem to find it anywhere.
The Honourable Minister of Health.
Thank you, Madam Chair. I understand it has been transferred to the Nova Scotia Hearing and Speech line.
The Honourable Member from Halifax Needham.
Great, I should have thought to look there, I must say. I'm wondering, I want to ask a bit about the department's plans with respect to the allocation. I know monies were allocated, $300,000, to examine the pain clinic problem, but as I understand it, there's a 2 to 3 year wait time for this clinic. And I also understand that they had a particularly well-respected member of that staff leave the province not so long ago. So I'm wondering how the department anticipates that this amount of money will be used to deal with the 2 to 3 year wait for that particular service.
The Honourable Minister of Health.
Thank you very much, Madam Chair. I can tell the honourable member that that this allocation of funding is really a step in the process. It is not intended that this will in any way fully address the wait time, but for us to effectively address the wait time, we felt it was necessary to do appropriate planning around that. So some of the 300,000 referenced in the budget is to allow that planning to take place, but we are also hopeful that that a good portion of it will go to providing service to clients directly. And we anticipate that with the the completion of planning, that this is a number that would be enhanced in the future so that we can effectively address that wait time. It's one I can tell you from a personal perspective that I take considerable interest in and want to see that wait time brought down to a reasonable period of time. Certainly individuals who are suffering pain for long periods of time, having suffered some for short periods of time, I can only imagine what it is like when no relief is in sight.
The honourable member from Halifax Needham.
Thank you very much, Madam Chair. I think certainly from the perspective of, representing a constituency where you hear from people all the time, this is certainly one of the areas where you hear some horrendous stories of people who are living with just inordinate amounts of pain, debilitating pain that really renders them immobile, unable to get out of the house, unable to go to work, unable to look after their children, unable to really have any quality of life. And it's, I think, truly shocking to know that there is this kind of a wait for a clinic that could provide relief. And I would, I would look at this amount of money as being just a very, very cursory drop in the bucket to what probably is required. Having said that, I accept that it's important that the problem that needs to be addressed needs to be understood. But I would think that in that mix, it was very disturbing to learn that, a well-respected member of the staff from that clinic was lost, and I think we really can't afford to lose qualified and skilled people out of the province. For whatever reason, I really have no idea what the issues were around that, but all I do know is that the wait lists are unacceptably long for that particular center. I want to ask the minister about another group that are waiting, this time for a different kind of relief, and that is the people with Fabry disease here in Nova Scotia. I think the minister would be very aware of the group of people that I refer to, because I'm sure you get the same phone calls and letters that I do from people who suffer from Fabry disease, who have found this new drug therapy has made a tremendous amount of difference in their lives. And while I recognize the enormous cost, the financial cost of this medication, I think it really does speak to the need for a catastrophic drug program, and in the interim, some kind of a response that would make sure that those people don't lose this therapy, which has made such a difference in their quality of life. And I think somebody wrote me an email on this the other day, and they said if there was ever a reason for a public health care system, it was to provide health care for people who had absolutely no ability to be able to absorb the cost personally. And if there's ever a case in point, then certainly this would seem to fit that characterization of why we have public health care. So I'm wondering, why is it that we haven't heard any movement on this in Nova Scotia, and when can those families expect to hear what they hope to hear, and that their drug therapy will not be lost to them?
The Honourable Minister of Health.
Thank you very much, Madam Chair. The issue raised by the honourable member is indeed an issue that is as she indicated, points to the need for us to have in place an approach, and we believe that it needs to be a national approach with respect to the issue of orphan drugs and orphan diseases. Typically, those are diseases which are very rare and diseases which require considerable expense in terms of treatment. And I've not only heard from people with the disease through letters. I've had the opportunity of meeting with them and listening to their descriptions of the disease and the impact that it has on their bodies. And it's an extremely difficult situation for them. I find it very difficult in being able to, in any way, have the capacity to understand what they're going through, because the disease is very devastating, and what it does to their lives and to their bodies and how it attacks their bodies is something that is truly regrettable. And we do in this country need to find a more comprehensive approach than is currently the case. And the situation as it is now is one where treatments of this nature are referenced or referred to the Common Drug Review Agency in Canada, established by the provinces and territories to evaluate treatments that are brought forward. And that evaluation has indicated from a scientific perspective that there is no impact on the affected organs, i.e. the heart and the lungs and the kidneys, and that there is no, from a scientific perspective, there is no change with respect to the functioning of those organs which are affected by the disease. Now, that is not to say that the methods could not be improved relative to the assessment process, and there is another step that is referenced by the companies that produce this, and certainly if it goes to another level and there is another reference and it is deemed that there is a positive result, meaning a good result for the effects of the drugs on the disease, then it would be, I know that all jurisdictions in the country would be looking at the situation again. Now, what we have done as provincial and territorial ministers, we're really two initiatives that we developed. One is that we have written to the federal minister requesting that the Health Canada become involved in a process with the provinces and the territories to develop a common approach with respect to a strategy that would deal with orphan drugs and to treat orphan diseases. And that would require the involvement of the Government of Canada. And we invited the federal minister to become involved with us with a view to being able to address a common strategy at the federal, provincial, and territorial ministers' meetings that are held in September annually. And we had hoped that the federal minister would have been at our meeting in Toronto at about 3 weeks ago. The federal minister was not there, unfortunately. I did have a telephone conversation with him, and he assured me that the officials of his department would be working with the provincial territorial officials with respect to formulating an initiative that could be brought forward to the federal, provincial, territorial meeting in September with respect to the development of a national strategy. Now, in addition to that, we as provincial territorial ministers recognize that while the Common Drug Review Strategy is what we have to evaluate these drugs, that there may well be some room for improving that particular process, particularly as it relates to the numbers of individuals that are available for a test of these pharmaceuticals. And we are currently developing through the provincial territorial ministers a further approach to the Government of Canada and the pharmaceutical companies involved. And I hope to have details of that approach worked out that I could share publicly in the very near future. And until such time as it is all worked out, I don't want to get into talking about what it's going to look like until such time as it is brought forward. But indeed, it is. I can assure the honourable member and everybody that it took a considerable amount of time at the recent provincial territorial ministers' meetings, and we believe that that the whole approach to how these drugs are assessed needs to be looked at, and that needs to be dealt with through a national strategy.
The honourable member from Glace Bay.
Well, thank you, Madam Chair. I guess before I start, just a few comments. I probably might have to go back and review Hansard to clarify some of the stuff that I've heard so far this afternoon, not just from the minister, but from my good friends in the NDP as well. I am glad that they have now finally realized that wait times are an important issue in healthcare, which is something that we've realized for some time now. It's been quite a while since we initiated our roundtable on healthcare wait times, and then did up a report and dealt with some of the issues concerning wait times. But along with that revelation this afternoon, I've also found it. I don't know if the minister is telling us, or if they've actually bought this from the minister, that actually putting the length of wait times and where they exist on a website is going to cure the issue of wait times in Nova Scotia. That's totally unbelievable. I'm the first person in the world to argue in favor of communications and letting people know. But simply by posting how long wait times are going to be and where they exist on a website for everyone to visit does absolutely nothing to even put a dent in the problem or try and solve the problem of wait times. As my colleague from the NDP did state, there's even a problem identifying exactly what wait times are in this province, and a committee that's struggling with that issue as well. But I also have to point out, and this I'll really have to check Hansard for, Madam Chair, is I find it rather unbelievable and actually flabbergasting and somewhat turned weak in the knees when I did hear my good friends in the NDP say that they don't have a problem with private clinics in this province, and that indeed they agreed with the minister that there shouldn't be a problem in that area, Madam Chair. So I did say that. And here.
Order. The honourable member from Halifax Needham.
On a point of order, Madam Chair. The honourable member knows full well that there was no statement made that the NDP has no problem with private healthcare clinics. And I would challenge him to find in the Hansard where that statement was made by me or any other member of this caucus.
Thank you. It's not a point of order, but a disagreement between two members. The honourable member from Glace Bay.
Thank you, Madam Chair. As I said initially in my comments, I'm going to check Hansard just to make sure that my hearing is correct. But to think that to think that private clinics are going to start springing up in Nova Scotia and they won't cause a drain on already depleted human resources that we have in the public health care system, Madam Chair, is totally unbelievable, totally unbelievable. And also regarding, I'm not sure, the minister went on with a rather pertinent question from my colleague from the NDP regarding Fabry disease. And the minister went on for quite some time, just in the last 15 minutes or so, and I will check answered as well, because I don't think the minister actually gave the people that are suffering from that disease right now an answer. You can blame it on the federal government, but I think one of the questions, and I'll ask it again later on during my time here, is what's being done about the problem, what's going to be done to help these people who are suffering from this disease. And I think the minister talked circles and circles and circles around that question, and I'd like to go back at that sometime in the not too distant future. But anyway, to begin with, Madam Chair, let me begin with stating that this government has signed a couple of health accords with the federal government. One, which provided $30 million for medical equipment, and the second accord, which was signed in 2003, 2004, that provided another $45 million for the equipment. So one for $30 million and one for $45 million. Is that correct, Minister? Are those the two accords that were signed, and is that how much they were worth?
The Honourable Minister of Health.
Thank you very much, Madam Chair. The first agreement provided $45 million, and that was $15 million per year over a period of 3 years. And then subsequent to that, there was an additional $15 million provided as a result of the last agreement.
The Honourable Member from Glace Bay.
Let me ask the minister, Madam Chair, if he could turn his attention to page 11.23 of the supplementary detail. Out of the $15 million that was provided, from what I can see indicated here anyway, only $4.8 million was actually spent in 2003-2004. Could the minister tell us where did the remaining approximately $10.2 million go, and where exactly it is?
The Honourable Minister of Health.
Thank you, Madam Chair. The remainder of the money, Madam Chair, is in a trust fund, and that's the method that's employed for the expenditure of these funds. They are transferred to the province, and the province puts them in a trust fund that is created and then draws upon that trust fund. The remaining money to which the honourable member refers will be allocated in the course of the coming year.
Honourable Member from Glace Bay.
Madam Chair, let me ask the minister then. So, if that's correct, the $10.2 million did go into a separate bank account, correct? It's a separate bank account. Is that bank account now collecting interest on the money that's in there?
The Honourable Minister of Health.
Madam Chair, the money that is received is put in a separate fund. It's referenced as a trust fund, and that is set up in such a way that it accumulates interest as long as it is in there.
Honourable Member from Glace Bay.
Madam Chair, let me ask the minister then why isn't that money spent? Why not spend the money instead of having it in that trust account?
The Honourable Minister of Health.
Thank you, Madam Chair. Madam Chair, we work with the district health authorities to establish their priorities with respect to the expenditure of this money on the funds. And we're currently, for instance, involved with in discussions with Capital Health relative to the expenditure of funds there. We have not, although we're moving very close to it, we have not reached a final agreement with respect to what they believe is the best expenditure of those funds, because I can assure the honourable member that the amount of money that's available in the funds is not the amount of money that we would like to have to meet all of the requirements of the district health authorities.
Honourable member from Glace Bay.
Thank you, Madam Chair. I can understand that, Mr. Minister, but again, on page 11.23, for the 2004-2005 year, it again appears that the government has not spent its full $15 million. So why not?
The Honourable Minister of Health.
Thank you very much, Madam Chair. Sometimes there's a gap between the decision to spend money and the time in which the money will actually flow. So that, for instance, the MRIs that were announced, it is our intent to spend the money for the purchase of those MRIs. However, the scoping work needs to be done with respect to the district health authorities' desire relative to the actual MRI that they would prefer to have. There is work being done by the department to see whether or not there are ways in which we could purchase or make those purchases to save the greatest amount of money relative to the purchases. So there is a gap in time between the decision to spend money and when the money actually will flow. And that is why the money was given to us in the form of trust accounts, because that recognition existed on the part of the federal government that the flexibility was needed by the departments of health right across the country to be able to have the flexibility they need to flow the money in an appropriate manner. Because if we had to do it all in a given fiscal year, then some of the decision-making processes that are required relative to such significant purchases may be rushed inappropriately, and the best decisions may not be taken. I can assure the honourable member that every cent of the money provided to us by the Government of Canada will be spent on the purchase of medical equipment for the people of this province.
The honourable member from Glace Bay.
Thank you, Madam Chair, and I guess I'll accept in part that answer anyway. What I'm wondering is that if you have the money, what are you waiting for? Obviously, the need exists out there. This is meant for medical equipment. If you take a look at it, Madam Chair, of the $75 million that's been allocated from the federal government to the provincial government for medical equipment, an estimate since 1999 will show you that only $35 million has been spent of that $75 million. So let me ask the minister, where the other $40 million that's there, give us some indication of what's taking so long. What are you waiting for? Why haven't you spent that money? Because we know that it's needed. And as well, another question, give us some indication as to a dollar amount that was requested, for instance, last year by the district health authorities, and how much they're looking for in medical equipment.
The Honourable Minister of Health.
Thank you very much, Madam Chair. The amount that was committed in 0304 is $14,957,538, and the amount committed in 0405 is $15.795 million, and we have in 0506 $14.6 million. But very significant portion of that 14.6 million is in fact committed. That is, the decision has been taken to spend the money. But, Madam Chair, if a district health authority needs to do a renovation, such as they had to do in the Cape Breton Regional Hospital, for instance, to accommodate their MRI, then it takes time to get that renovation done. And you can't begin the renovation prior to the commitment of the money. So I'll point out to the honourable member again that between the decision to commit the money and the opportunity for the money to flow, very often a lot of work has to be done in order for that to happen. And whether it be a renovation or whether it relates to doing the necessary research to identify the best equipment to meet the needs of the district health authority, or whatever the case may be, due diligence is required relative to that. So in expenditures of this nature, it is not unnatural for the process to take longer than a single fiscal year. Therefore, we will always be in a situation where there is committed money which remains unspent, but nevertheless will be spent when the time comes to make the purchase of the equipment in question.
The honourable member from Glace Bay.
Well, Madam Chair, I'll accept the minister's word for now that every single dollar that's been allocated by the federal government will be spent purchasing medical equipment in Nova Scotia. Every dollar. What happens to the interest on the money that's now in trust, Mr. Minister? Is that also spent for purchasing medical equipment?
The Honourable Minister of Health.
Yeah, thank you, Madam Chair. Again, I will repeat, every single penny that we receive from the federal government goes to the purchase of medical equipment for the people of the province of Nova Scotia, including all interest that is earned through that money while it is in deposit.
The honourable member from Glace Bay.
Thank you, Madam Chair. And I also, there was a question, the minister may have missed it when I asked it because it was on the end of my last question concerning the money, but it was, could you give us an indication, what's, as close of an estimate as you could, to the dollar amount that's requested by district health authorities for medical equipment?
The Honourable Minister of Health.
Thank you, Madam Chair. It's a huge number. However, if you start to boil it down in terms of what is essential from one period to the next, we hope that in the short term we are meeting the essential needs. In the long term, there is a significant gap relative to the funds that are available for the purchase of capital equipment and the province's capacity to be able to meet those purchases. And that is why we have, on every occasion that presents itself, have commended the Government of Canada for their program of capital equipment purchases, because it is something that all provinces are going to have a continuing need for as we move forward. And I know from my discussions with my provincial and territorial colleagues that the demand that is out there in this province is not different from the demand that exists in other provinces. But I'm sure that if the federal government were to provide us with an additional, we'll say, $60 million over the period of the next 3 or 4 years, that we would indeed find a very good place for that money. But at any rate, Madam Chair, we're in the short term meeting needs. In the longer term, we have a gap, and as I said, in the course of the next 3 years, if we were to get an additional $60 million, we would find places for that very easily. So it is a challenge. It's a national challenge that we face.
The honourable member from Glace Bay.
Madam Chair, I understand that, Mr. Minister, but I didn't hear a figure there. And if you could you possibly put a figure on it, just an estimate of how much we're looking at in terms of when district health authorities, they must put in requests for medical equipment in each DHA, and we know we have problems in terms of how late it is getting business plans approved for district health authorities from the government. But what I'm looking for here is a dollar amount that's requested, at least last year. The request last year by district health authorities for medical equipment. A dollar amount, please.
The Honourable Minister of Health.
Thank you, Madam Chair. On an annual basis, we ask the district health authorities to submit their top 3 priorities to us. And if you were to examine the top 3 priorities presented by the district health authorities, then the number is in the vicinity of $120 million.
The honourable member from Glace Bay.
Thank you, Madam Chair. Let me ask the Minister, each district health authority then would submit 3 top priorities. Could you give me the process in place to determining whether or not those, what of those 3 are selected, how many are selected, and is it always the top priority gets the funding, or does what comes into play there, Mr. Minister, please?
The Honourable Minister of Health.
Thank you, Madam Chair. There is a rather detailed process that is followed by the Department of Health in consultation with the district health authorities. And one of the principal criteria, for instance, that is applied is related to safety in terms of the healthcare workers and the patients. Another is related to how the equipment that is being requested will fit with a broader regional need that might exist in terms of what is required, so that we're not providing equipment that might be not fully utilized in one area, but if they were provided in others, it would be. But for the most part, and most of the time, we are able to address the top priorities of the district health authorities. But again, it's not simply a matter of them submitting a list and we say aye, yes, or no to it. We do sit down and go through a very thorough consultative process before the final decisions are made.
The honourable member from Glace Bay.
So, Madam Chair, just to end on this topic, if a district, for instance, if the Cape Breton District Health Authority would submit 3 top priorities and the Capital District Health Authority would submit 3 top priorities, it's not necessarily the case that any one or all of those 3 priorities would be selected for funding by your department. Is that true? There could be other priorities that the department sees as being higher on the list and would be funded, not necessarily those recommended by the District Health Authority?
The Honourable Minister of Health.
As I indicated previously, we, for the most part, are able to meet the priorities of the district health authorities when they are submitted. And sometimes we will look look for a sort of a theme, if you like, in terms of what the district health authorities are placing an emphasis upon across the province. And if we see that there is a commonality to that, then sometimes it is appropriate to look at a decision that favors a number of districts at the same time. So it's, as I indicated, we, for the most part, and we're able to meet their priorities. In situations where we may not be able to clearly meet their priorities, a decision to do otherwise would be taken only after there was thorough and complete consultation with the District Health Authority.
The honourable member from Glace Bay.
Thank you, Madam Chair. Let me shift my focus here for a moment to a matter that the minister referred to in some previous remarks, saying about wait times, just how important communications are. I think you made that reference anyway, to communications and posting information on websites and making sure that the general public knows what's going on. Back in the 1999 election campaign, if you recall, and if not, then let me remind you that the leader of the third party at the time, Dr. John Ham, stated that we needed less spin doctors and more doctors in Nova Scotia. Well, Madam Chair, since this government came to power in 1999, the communications budget for the department has increased by over 90%. A 90% increase since 1999. And it's now budgeted at just a little over $799,000. Can I ask the minister then, back in 1999, how many communication officers were in the department at that time?
The Honourable Minister of Health.
Madam Chair, in the interest of accuracy, I would take that question as notice and get the precise number for the honourable member. I don't have it at the time. I consulted with the former Minister of Health, and he was suggesting a number, but he wasn't entirely sure of its accuracy. And I think in the interest of providing the committee with the best detail we can, I'll take that as notice and get back to the honourable member.
The honourable member from Glace Bay.
Thank you, Madam Chair. It might be wise for the minister to consult with the former Minister of Health. He may very well have been the one who started the ball rolling on increasing the department's budget by over 90%. I'd also like to know, and you may not have those figures with you today either, just how many communications officers there are in the department today. Madam Chair, the communications budget is increasing by $176,900. And I'd like to know from the minister why the increase. He's promised that he's going to tell me how many more communications officers there are now compared to back in 1999. But he must have some sort of a plan, or someone somewhere must have some sort of a plan, just what they intend to do with that increase and for what purpose. What would be the increase of taking a 90% increase in a communications budget? Is there a plan in place, and does the minister perhaps could fill us in on the details, what that's going to be used for, that additional money?
Honourable Minister of Health.
Thank you, Madam Chair. I understand there are now 7 communications officers in the Department of Health, and I will get the number for 1999. One of the challenges in a department that is as huge as the Department of Health. We have somewhere in the vicinity of, I believe, 38,000 people that derive their income from this department. Just as one indication of the amount of resources that are required to keep this department going. There are large numbers of issues that arise every single day within the department, and I can assure the honourable member that in order to be able to try to respond effectively to those issues, that it is necessary to have communications resources to be able to assemble the facts of a situation, the background of a situation, and to assist in ensuring that the information we provide to Nova Scotians is the best information we can possibly provide to them. In terms of our planning, we have developed something that did not exist previously in the Department of Health, and that is the plan. The plan is entitled Your Health Matters, and a very important part of that plan is to be able to communicate its contents to Nova Scotians, and also to be able to provide answers to Nova Scotians relative to the issues that are in the plan. So I can say to the honourable member that we are challenged within the department with respect to being able to respond to issues that come forward on a daily basis, and there are indeed many issues that come forward on a daily basis. But also, it's necessary for us to try and ensure that Nova Scotians have the very best information available relative to the workings of the department and the issues that are being addressed by the department.